Let's talk about cystic fibrosis in this video. So cystic fibrosis is a fatal multisystem genetic disorder because of abnormal iron transport function caused by inability to adequately hydrate the mucus. So cystic fibrosis is an autosomal recessive disorder. Mutation of gene is present on long arm of chromosome 7. Gene codes for a chloride channel known as cystic fibrosis transmembrane conductance regulator, that is CFTRG. Important MCQ, it is autosomal recessive and it is present on chromosome 7. The gene is CFTR conductance regulator gene. It influences salt transport across the cellular membranes. It is a fatal multisystem disorder. It causes abnormal ion transport across the membrane, and it inadequately hydrates the mucus in the body. So which means that symptoms will be present wherever mucus secretion is, so mucus secretion will be altered all throughout the body. So it will create symptoms accordingly in those symptoms, those systems. Clinical features, if the patient usually presents during infancy only. So it presents, the earliest symptom it presents is meconium ileus. Pancreatic and intestinal manifestations occur early. Pulmonary manifestations occur late, beyond the neonatal period. And the most common cause of mortality is due to the pulmonary complications. So characteristic features you have to remember is meconium ileus. It will present, the systems affected mostly are pancreas, intestines, and pulmonary manifestations also. Death is usually due to pulmonary complications. So respiratory system, coming to the upper respiratory tract, because of the stagnation or the secretions which are not cleared, so an abnormal mucus secretion, the symptoms will be chronic sinusitis, rhinorrhea, and because of chronic mucus formation and it is inadequate clearance, it will lead to nasal polyps, right? Coming to the lower respiratory tract, the earliest manifestation is of a small airway disease. The earliest symptom is of cough, right? The final expression, usually patients have bronchiectasis, and the earliest and the most severe changes are in the right upper lobe. This is an important MCQ. Symptoms of bronchiectasis in a case of cystic fibrosis are usually in the right upper lobe. So coming to the pathophysiology, persistent cough will cause mucus, viscous and purulent sputum when the frequency of exacerbation will increase. Increased sputum and increased cough volume, because of when there is increased frequency of exacerbation, there will be increase in the amount of sputum, there will be increase in the amount of cough, which will ultimately lead to decrease in pulmonary function. The children with cystic fibrosis will have failure to thrive and ultimately develop respiratory failure. So initially the duration between the two exacerbation is less, and later as the disease progresses, the frequency of exacerbations will increase, and ultimately it will compromise the pulmonary function and it will cause failure to thrive and ultimately lead to respiratory failure. The newly diagnosed cases, the most common organism is Haemophilus influenzae and Staphylococcus aureus. In established cases of cystic fibrosis, the mucoid forms of Pseudomonas are found more commonly. When you do pulmonary function test in a case of cystic fibrosis, it is usually of obstructive pattern. Now coming to a very important aspect of cystic fibrosis, the complications of cystic fibrosis are pneumothorax, respiratory failure and cor pulmonale. So people die usually of these complications during the post-infancy, during early childhood. Coming to the gastrointestinal tract, important organ which is affected is pancreas. Initially, it will present with exocrine pancreatic insufficiency. It will cause steatorrhea and azoturia. Because of pancreatic insufficiency, there will be malabsorption of fat soluble vitamins and fat. Ultimately, it will lead to malnutrition. As I've told you that, the mucus plug formation, it will block the intestine, so it will cause intestinal obstruction, appendicitis, recurrent acute or chronic pancreatitis. Increased incidence of GI malignancy is seen in patients of cystic fibrosis. Right. So this is a meconium plug, right, which obstructing the colon. So at the mostly at the ileocecal junction, this is the dilated ileum which you can see, and the colon there is microcolon due to the obstruction. Now coming to the genitourinary tract, there will be late onset of puberty in both males and females. There will be retardation of bone age. 95% of the men will be azoospermic and 20% will be infertile. So diagnosis, one of the most characteristic clinical features should be present, described previously, and abnormal sweat chloride ions or nasal bioelectrical response, which is also known as transepithelial potential response. For diagnosis, you can do pilocarpine, iontophoresis. Sweat chloride ions more than 70 milliequivalent per liter is a distinguished feature. So this value you have to remember, 70 milliequivalent per liter. So coming to the treatment of cystic fibrosis, if you have understood the clinical features and the complications, you can treat accordingly. So most important is you have to prevent frequency of exacerbations and ultimately prevent respiratory failure in patients of cystic fibrosis. So clearing the secretions is very important, which is done by breathing exercises, chest percussions and recombinant human DNAs. So because to prevent frequent exacerbations will further worsen the pulmonary function. For that, you can give long courses of culture guided antibiotic therapy. It is very important to send culture. Culture guided is very important. Innate beta 2 agonist and anticholinergics provide temporary relief. But the only effective therapy once respiratory failure sets in, the only effective therapy in case of cystic fibrosis is lung transplantation. So finally, nothing is going to work if there is no available lung for transplantation. The child is going to deteriorate and there will be failure to thrive and the patient is going to die. As we have studied that one of the important pancreatic complications is pancreatic insufficiency. So you can give pancreatic enzyme replacement after every meal, replacement of fat soluble vitamins so that to prevent their deficiency, treatment of acute obstruction by enema of hypertonic radiocontrast material.